Welcome back to Pebble series with me Kavya Tendral, differentiating the difficulties. This is video 3. The prime motto of this video is to remember the concept and retry at the critical time of demand, especially at the orals and solving the MCQs. Today we'll see about the theories of cholesteatoma, definition of blindness, reference man and reference women, at last conductive hearing loss. Before we actually go to cholesteatoma of theories, we'll know what is cholesteatoma. This is the most important topic in ENT and the most important misnomer in ENT too, because as the name suggests, it can mislead us. Cholesteatoma, chole refers to cholesterol, it is not cholesterol. Oma refers to a neoplastic lesion, it is not a neoplastic lesion. That is, it is neither the cholesterol crystal containing lesion or the neoplastic lesion, but it is a locally aggressive expanding middle ear cleft pathology. What is that aggressive? It is basically the skin in the wrong place. We know skin is lined by the squamous epithelium, and the squamous epithelium is known to produce keratin, and therefore it is also called as keratinoma or epidermosis. Next, because of this, it is also called as squamous disease of middle ear. Now, there is squamous disease, and thereby this has gaining a name of unsafe ear. Why that is unsafe ear is because this lesion has enzymatic bony necrosis property with the activity of osteoclast and mononuclear cell. Thereby, because of bony necrosis, there is foul smelling, purulent ear discharge, and also accounting to granulation tissue formation around the osteitis area, in turn resulting in the blood stained property of the ear discharge. Thus, cholesteatoma is known for its complication. Now let us see theories of cholesteatoma. First, it is basically some congenital cell risk can be present in turn that results in congenital cholesteatoma. Next is Witt-Max theory. In Witt-Max, we see 2T and 2A. It is like something is duplicating or something is going somewhere. So here it is referring to the retraction pocket of tympanic membrane. From tympanic membrane, some retraction pockets are getting produced entering into the middle ear cleft. And the next is Rudy's theory. Rudy sounds like root. A root is one which is present below the ground or the soil, that is expanding like this, like it is increasing in number and as well the size. That is basal cell hyperplasia. So it is root is in the base and there is increasing hyperplasia. Next, coming to Haberman theory. We know Heb means that is possession. When a man with a mind of possessing everything, that is epithelial invasion. There is invasion of the epithelium through the tympanic membrane perforation. In cholesteatoma, it is associated with attic perforation or the postero-superior part of the pars tensa. Let's come into Sadie's theory. We know SAD. Someone getting SAD is because there is some change is taking place, and here the change is called the metaplasia. As we said, cholesteatoma is the skin in the wrong place. Squamous lining, here it is a squamous metaplasia, and these are all the theories related with cholesteatoma. Next, coming to blindness. The WHO definition says that less than 3/60 visual acuity in Snellen's chart is considered to be blindness. Remember 3, WHO is 3 letters, so it is less than 3, and less than 10 per degree of central visual field loss. When we are drawing the visual field, it is 30 degree, 20 degree and central 10 degree. Even this 10 degree is also lost, then that is considered to be blindness. Or sometimes the person is not able to read not able to count, not read, it's counting fingers 3 meters apart, then it is also considered to be blindness. Let us see the other forms of blindness. One thing for sure is total blindness, it is no perception of light. Legal blindness, we know legally is one for one, and thereby is blindness less than 1/60 to perception of light is legal blindness. Social blindness, the moment we remember social science, one thing comes to mind is map, right? In every social science exam you take map, thereby map is 3 letters, so it is 3/60. It is blindness, so less than 3/60 to 1/60. Then in economic blindness, it is less than 6/60 to 3/60, and this is all about the other definitions of blindness: economic, social, legal and total blindness. Economic less than 6/60 to 3/60, and social is, we need to remember map 3 letters, so less than 3 by 60. Legal is less than 1 by 60 and total is NPL. Let us now see the definition of reference male and reference female. If we are saying someone as a reference, then that person should be always free of disease because we are dealing with medicine. So it should be free of disease, he should be physically fit and working active, and as well age of 18 to 29. When we are saying someone, the moment we hear that he is so and so, we will be asking about the age, height, weight and BMI because he is a reference. So the age is less than 30, it should be a major. So it is 18 to 29 years. Height 1.73 meters for male and female F for 5. So remember, like for weight it is 55 kg and the height is 1.61 meters in case of female. Coming to BMI of female is more than the male, to be noted. In female it is 21.2, for male it is 20.3. And in case of a female, she should be non-pregnant and non-lactating female for being a reference female. To concise again, height 1.73 in male and here 1.61 meter. Weight in case of male is 60 kgs and in case of female is 5 and 55 kg. Always the BMI of female is more, so 21.2. Here male is 20.3. Free of disease, physically fit and 18 to 29 years. Now we come to how to easily remember the numericals associated with a conductive hearing loss in different lesions of ear. We know conductive hearing loss is the loss from the pinna to the oval window. Let us see what are the lesions and the numbers. Lesion of external auditory canal, that is EAC. It is 3 letters, so it is 30 decibel loss. Coming to tympanic membrane is one tympanic membrane in 4 quadrants, so it is 10 to 40 decibel loss. Coming to oscillator discontinuity, the ossicles are small bone. To remember it, small as 5 letters and bone is 4 letters, so only oscillator discontinuity it is 54 decibel. In case of oval window pathology, then it is 60 because oval window is a part of tympanic cavity, that is one of the wall, that is a medial wall. Total number of wall in tympanic cavity is 6 walls, so remember like 60 decibel loss. And other two things are, in case of malleus fixation, malleus is the first ossicle and thereby it is 10. It is articulating the second ossicle, so 2, 5. So it is malleus fixation, it is 10 to 25 decibel loss. And in case of ossicular interruption with perforation, so there is a perforation and as well there is ossicular interruption, there is 38 decibel loss. A great wonder, because there is a perforation and there is discontinuity, still there is 38 decibel loss because the vibration produced can, or the air can directly go trigger or activate the oval window, and thereby the decibel hearing loss is lesser when compared to intact drum. Thank you so much for your patient listening.